Rockingham County news and information. Mike Moore Media.
Hey everybody, and welcome to the April edition of At Home with ADTS, a monthly show where we discuss topics of interest to older adults and their family caregivers, as well as highlighting some of the services and supports offered by our organization. I'm Cathy Powers, the Executive Director here at ADTS, and my co-host, as always, is Asheley Cooper, our Director of Adult Day Services. Aging, Disability, and Transit Services, or ADTS, has been in operation in Rockingham County since 1973. Formerly known as the Council on Aging, our goal is to enhance the quality of life for our citizens in Rockingham County and support them to achieve optimum health, well-being, independence, and participation in our community. We do this through 8 core programs that serve over 17,000 people annually. But we can't do this alone. We rely heavily on community support. So we always like to start every show by thanking the organizations that have supported us over the past year through our Community Partners program. Thank you as always to Pelham Transportation, Carolina Apothecary, Wells Fargo, Home Trust Bank, CJ Medical, Sparks Oil, the Rockingham County Community Foundation, the Rockingham County Arts Council, Colonial Funeral Home, Church of the Epiphany, JDK Automotive, Wilkerson Funeral Home, Annie Penn Hospital, Eden Rotary, BB&T, Reedsville Rotary, Woodmont United Methodist Church, and Plaza Mini Storage. We thank you all for your continued support. This month, we also want to give a big shout out to the 88 businesses across Rockingham County that supported Meals on Wheels throughout the month of March through our March for Meals campaign. Thank you so much for all that you've done to support our program. We also like to give a special thank you to the United Way of Rockingham County for their longtime and generous support of the Meals on Wheels program. United Way of Rockingham County brings together local people to raise local dollars to meet local needs, and we thank everyone who has contributed to this year's campaign. I also want to mention that the United Way will be hosting a Fast Four men's and women's and mixed doubles round-robin tennis tournament on May 18th at the Eden YMCA from 8 a.m. to 8 p.m. If you'd like to sign up, you can contact Casey Vincent, the Executive Director at the United Way, at 336-342-7768, or you can email her at Casey, C-A-S-E-Y, at uwrockingham.org. Now I'm going to turn the program over to Ashley, who's going to introduce today's guest.
Thank you, Cathy. This afternoon we have Alyssa Gilboy, is a Community Care Coordinator for the Triad Healthcare Network Care Management Program. Triad Healthcare Network is an accountable care organization in partnership with Cone Health Systems, a 6-hospital system located in central North Carolina. Alyssa has 30 years of nursing experience, which includes bedside critical care nursing, clinical education, and program management, and 19 years of case management in the areas of acute hospital case management and community case management. She is a native of Virginia and received her Bachelor of Science in Nursing degree in nursing from Radford University and Master of Healthcare Administration degree from Pfeiffer University. Alyssa is a National Certified Case Manager and member of the North Carolina Piedmont Triad Chapter of CMSA. Alyssa presented nationally at the CMSA 25th Annual Conference and Expo in Orlando, Florida in June 2015 and was the division winner for the 2018 Cone Health Nurse Excellent Award.
Congratulations.
I know, wonderful.
Thank you so much.
We have such a wonderful resource here today.
Absolutely.
I'm very excited. So let's just jump in. Can you tell me about what Triad Healthcare Network is?
Sure. Triad Healthcare Network is an accountable care organization. So most people hear ACO, that's kind of our little short name we go by, and aren't sure what that is. An accountable care organization is a physician-led organization which enables the physician and other members of the patient's care team to work together in a coordinated effort to achieve outcomes that are what the patient is looking for and what we as a health system are looking for in terms of being able to achieve the best possible outcomes.
Wonderful. And what is your role in that?
My role is Community Care Coordinator is actually my title. Most people would refer to what I do as a case manager or a care manager. So my job is to meet face-to-face with patients with lots of phone calls in between physicians and any other member of the care team to come around the patient and sort of help them to develop and meet their own personal health care goals.
Wonderful.
I was just going to comment that team approach is such a necessary piece, because historically you think back 20 years or 30 years and you had all of your specialists who were doing what specialists do, and then you had your primary care physician and it seemed, and the pharmacist and the individual, and it seemed like everyone was doing what they knew and they specialized in, and there really wasn't a lot of collaboration. But this new team approach really does offer much better outcomes for the individual.
Yeah, we like to call that design of care working in silos. So the patient was floating around, primary care physicians doing one thing, specialists another thing, pharmacists another. And the approach that we've taken in the model of care we've tried to develop is one where the patient is in the center. So we call that a patient care delivery model, patient-centered care delivery model. And then we try to break down all the walls of those silos so that everyone knows what's going on, thus the name accountable. So we're all accountable to one another and to the patient for what's happening to them. So we do involve community physician, primary care physicians, specialists. We have our own pharmacists and licensed clinical social workers on the team. And we reach inside the team to help the patient, and then we reach outside of our immediate team to organizations like yours, to home care agencies, whatever it takes to help the patient develop and meet their own health care goals.
Well, because health doesn't happen in silos. We've had dental professionals join us on the radio show and mental health professionals, and it's not a piece, that's separate and apart from everything else. It's all tied together. Your dental health impacts your physical health, and everything is connected.
Yes,
absolutely. And so part of that too is that we're seeing a change in the relationship between a physician and the patient. And I think we're finding, can you speak to that a little bit about how that is evolving?
Yes, even in the course of my career, the difference in how patients relate to their provider and vice versa is drastically different. So in years past, you just did what the doctor told you to do. And the doctor typically was the person or the entity that you went to for all your health care needs. And so the nice thing is that in terms of training now, physicians and all other disciplines have been trained to approach the way they deliver care in a more collaborative way. And so I think we really are starting to work better together. But what that also means for the patient is that they have more than one person to go to, and their provider, physician, nurse practitioner, PA, whoever it happens to be, is now more often very happy to help them get in touch with that right person. So there's more communication. I think patients are beginning to feel more empowered and more like it's okay for them to raise their hand and ask a question rather than just do what they're told.
Well, and of course we have the baby boomers that are aging, and I think that just maybe there's a slightly different approach from the baby boomers as compared to some of the older generations who kind of grew up in that, you listen to authority and do what's told. And so I think it's great. I wonder how our generation is going to age.
It'll look different. It really will look different. And I think one of the nice things about that you can stand back and see with those generations is that now folks who may be taking care of their aging parents are more comfortable saying to providers, I'm not sure that that's going to work for us, or we have a problem, or can I ask a question, where their 85, 90, 95-year-old parent may not be comfortable with that because it's not sort of the model of care that they grew up with.
Right. Plus there's also access to additional information than we've had before, so we can do a little bit more research and maybe find there's a clinical trial or there's a different medication that has less side effects that might work better for...
Or Google it and find out that
Yes.
we're all dying
Yes.
from the common cold. I'm sure physicians love that we have so much information.
Right.
So much.
The first thing that comes up is always the word first thing that comes
Of
up.
course, of course. And that's what we want to talk to you about today is how to prepare now for a visit. Like, as you said before, it used to be that you just came in and they gave you the information and you left, but now you can be a partner in that. So what are some ways that you recommend that that patients prepare, or how should they prepare for their visit?
Well, I'm a big fan of and try to coach my patients towards keeping records, keeping their own medical record, if you will. It can be a notepad or their phone or a piece of paper, whatever they want to do, so that particularly if they have chronic health conditions or even if something new has popped up, I always say to them, start writing things down. Don't just record your blood sugar or your blood pressure, but write down, I had a headache today, or this didn't feel right, or since I've started on this new medication, this feels different. So keep your own medical record and keep it with you. Take it when you go to the pharmacy. Take it when you go to see your doctors, when you go to the dentist, even when you're going to the lab, because you just don't ever know when something might pop up, a question. If in your own medical record you have a list of phone numbers of all your physicians, the last time that you saw them, the last time you had a particular test, then that information is always right there. And that does a few things. It helps whoever you're seeing for care to get a better picture of what's going on. And it tends to make the patient feel a little bit more empowered, like they have the information too, so they can refer to that. So I would say keep your own medical record. Always take your medications, always, not just your list, but your medications in the bottles that they came in. There's lots of information on the bottle other than what the name of the pill is. That's helpful to us when we're trying to manage patient care. Which doctor prescribed this? Very frequently we'll find that a patient will have the same medication that has two different names prescribed by two different doctors. And it's not the patient's fault. No one told them that was the same medication. So taking your own record, taking your medications, which includes vitamins and things that you buy over the counter, even if it's your sister's allergy medicine that you started taking because the pollen was crazy last week. Go armed with questions. In your same little medical record or on your notepad, wherever you sit to do your morning reading, keep that in one place. And when you think of something or a question just pops into your head or a symptom, jot it down. And then you have that with you when you go to your doctor. It's really easy to get there, get busy with the nurse taking your blood pressure and getting your blood work, and then you completely forget what all your questions were. So be prepared with what you want to know about when you go.
Absolutely. And well, let me ask you this, how are the doctors feeling when you come prepared like that? Are you finding that they're open to that, or?
They're usually greatly relieved.
Okay.
They sort of don't have to start from scratch. Imagine, particularly if you haven't seen your doctor in 6 months or a year, because thankfully things have been going well. This doctor has seen maybe 20 other patients already today and has more to come. It's very helpful to your doctor or whoever you're seeing if you can walk in prepared saying, these are my medicines, here's what's going on with me, these are the things that I think are most important. It gives them sort of a springboard, a place to start from. Obviously, they have a detailed medical record, but your doctor really is concerned about what concerns you. So if you can get those things out there in the beginning, they really are grateful for that.
Sure, absolutely. So, we work in the field with older adults, and so do you think it's important to start building that foundation with the doctor now as you age, or is it okay to start at 80 going, hey, maybe I should ask a few more questions?
Anytime.
Okay.
Anytime. The key to life is communication. Certainly, sometimes the situation is that you find yourself with a new doctor. You weren't expecting to have to switch to a new doctor. And so that's a really great time to come to your appointment prepared and see if you can just give them a synopsis really quick. But if you're in pretty good health now and you've been with your same doctor for a while and you think, gosh, I've just been kind of going and doing what they say, start developing a little bit more of a detailed communication with them. And the reason is that, one, it makes it easier for the doctor to take good care of you. He wants to know how you feel about how your health care is delivered. So it's going to be easier for him to help you make decisions. And as in any relationship, the more you talk, the more comfortable you are, the easier it is for you to ask questions and say so when things aren't working well.
Well, and when you age, you have different needs, obviously,
right.
but there are also other topics that you may want to discuss with your physician that you hadn't approached in the past, like advanced directives. And so I would think that having that communication and feeling like that is a comfortable relationship and a safe place to have those conversations is really important.
It is really important, and I think I would underscore that the things that feel uncomfortable for you as a patient to talk about are things that your doctor is not uncomfortable hearing.
Right.
You know, it's not the most fun to talk about things like I'm constipated,
Right.
or I'm leaking urine, or I'm not sleeping well, or I'm becoming forgetful, or, you know, my daughter said I need to fill out these papers. She must think I'm dying. You know, just kind of put aside what you think may be any judgments towards you about those things. Say those uncomfortable things to your doctor. That's where you can do it, and that's where it needs to be discussed. And you know, if you're not sure how to bring it up, just start with, okay, this is uncomfortable, but I want to talk to somebody about this. It's a great place to do it.
Do you recommend that you bring somebody into your doctor's appointment with you?
I think it's a great idea to bring someone with you to your doctor's appointment, whether you're 40 or you're 80. And the reason is that whether you feel anxious or nervous about going to the doctor or you don't, we all tend to get a little tunnel vision, and we kind of want to know what our doctor is going to say when we're there. So you may get there and you're really focused on one or two things, and the doctor may say 10 things. So another set of ears and eyes may pick up something that you're forgetting about. Or if you are currently struggling with, you know, failing memory or just difficulty keeping things in order, if you have someone with you who you trust and knows that they are there to help you listen, tell them, say, I want someone to be with me who can help me listen so I don't miss anything. I think it's a fantastic idea.
And if it's a family member who tends to take over, maybe feel safe to say, you're here to observe and take notes for me, and this is not your appointment.
That's right. And here's another little trick. If you have a situation like that, then you as the patient go back first by yourself with your doctor and say, I brought my son or my daughter or my sister, and I want them to be here to listen, but could you help me keep the conversation going the way that it's supposed to go, and make sure that I have a chance to answer my own questions. Everyone in healthcare has experienced that at one point or another, and we want the patient to feel like they're the center of that time together, because they really are. That taking over bit happens a lot. So just go back by yourself first with the physician, and then say, okay, could you go get my family member or whoever it is?
Right. And that also doesn't mean that they then have access to everything that's going on in your medical history as well, that you're just, you know, trying to have an extra set of eyes or ears. And it's also okay if that's not the right person to ask a friend to come with you as well. So, absolutely. Let's talk about second opinions, because I think sometimes people get a little nervous that I still do anyway, and I'm a younger person. Whatever my doctor says is right, and then I had an opportunity to see another doctor in the practice, and they were like, hey, listen, we could adjust your med and just double this, and it made a world of difference. And but you know, like you said, we were just plodding along, and so, but the doctor was great. They said, so next time you see them, you might want to mention this. So, which was great. I felt like that was a good collaborative effort. But it's okay. Is it okay to get second opinions?
It is okay. And I would say, by and large, most physicians are going to understand that. But here's another little script that you can use that might help if you're uncomfortable about that. let's say your physician says, okay, we'd like to try this treatment or that treatment, or just stay on what you're on. You could always say something like, that's a big decision that I need to make, and I need to think about that. I want to talk to my family members about that. And I might even want to just get some more information, either from another doctor or somebody who has expertise in that area. Is there anybody that you could recommend if they maybe are willing to do that? And if not, the patient can always say, could I have a little time, to make my decision? I really want to think about that. And then there's all kinds of ways that you can yourself ask for a second opinion. You don't have to ask your doctor to refer you to the person for a second opinion necessarily. You could always call back to the office and say, I'd like to speak with another doctor, make an appointment just for a consultation so that we can talk.
And so, I do find a lot of times with our older adults that their doctors are retiring, and so they're nervous about trying to find somebody else to speak with. Sometimes the practice is folded in. Sometimes the doctor makes a referral. So what are some techniques or recommendations that you have for people who need to go and find another doctor to meet their needs?
So I think the first way is the easiest, and most people find this the most comfortable. Ask your family and friends, what doctor do you go to see? Who takes care of your diabetes? Who takes care of your breathing problems? And then you can just pick up the phone and call that physician practice and say, I'm looking for a doctor for this certain kind of care, and this is the kind of insurance I have. The person on the phone will be able to help you determine whether or not that doctor takes your insurance, whether the doctor is accepting new patients. And then the flip side of that is that you can call your insurance company. Just flip over your insurance card. There's a customer service number there, and you can say, hey, my doctor's retiring. I need to know what other doctors there are in the area that I might be able to get going with. Certainly the internet, if you want to search around. And the nice thing about that is that you can maybe have an idea of the practice you want to go to, or even a specialty, and you could just type in the specialty and the doctor's name. In our area, because of my organization, you could go directly to our website, triadhealthcarenetwork.com, all smashed together, and there's just a green button there that says find a provider. And if your insurance and provider work together within the network, then you can sort of apply the filters that you need to find a particular doctor that you need.
Well, I would think that there are lots of things to consider too, as well as beyond the insurance piece, and whether or not they're affiliated with a certain healthcare system or a hospital. Some people may have preference for a female or a male doctor. I mean, there are a lot of things to consider, so I almost think that you could kind of go through and say, okay, these are my priorities. This is what I want, and then kind of funnel it down from there.
Yes, it's worth, especially making such a big change. That's a really big deal, and especially as you become an older adult, you tend to spend a little more time with your doctor. I think it's worth taking a minute and getting out a piece of paper and writing down what is important to me. What do I want? What don't I want? And Medicare-aged patients, well, all patients really, but particularly Medicare-aged patients need to be aware that they have patient rights. And so they can choose which doctors they want to go to, which health system they want to receive their care in. Just because you live in a particular area where there's a health system in operation doesn't mean you have to use that health system. Of course, you have to be aware that if you go outside your health system, that may have implications for your insurance and how much things are going to cost out of pocket. But remember that who you receive care from, where you receive your care is entirely up to you. You just have to understand what it means on the front end and on the back end.
Well, and I think that office staff as well can sometimes be helpful, and you can call and get some information from them as far as If there's one physician in the practice, what happens when that physician is out sick?
That's right.
Or on vacation or whatever, is there an on-call person? Are they accessible after hours? I mean, there are lots of things that you could gather just from speaking to someone at the office.
That's right. They're very well trained, and they're accustomed to answering those questions. And it's perfectly okay to call and say, I've always had a lady doctor. I would like to still have a lady doctor, or vice versa. It really is okay. In the same way that when you go to buy a car, or you go out to dinner, or anything else that you go and make a choice about, the same thing holds true in your health care. You have choices, and it is okay for you to say, these are my preferences. I can't imagine a combination of preferences that the healthcare community can't meet in this day and age. There's always someone, and most of the time, if your physician is not able to meet whatever those preferences are, they can help you find someone.
Absolutely. The other thing I want to talk about is medication costs. I think that a lot of times we had a gentleman at the center who decided to live on his own, and his insulin was like $400 a month, and one of his adult children said, well, let me just Google that. And sure enough, they found something that was equally good that was like $50 or $60 a month. And I think a lot of times that might not, people don't think that that's a cost or something that they can have a conversation with their doctor about.
Right. I would encourage, even in the very beginning, when a physician is going to start a new medication for you, right at the beginning say, okay, great. First of all, why am I going on this medication? What is it going to do? What kind of side effects might there be? Do you already know that my insurance will help pay for this medication? If you don't know, who can I ask? Offices now have a staff member whose job is to help patients. It may not be their only job, but one of their jobs is to help patients get their medications. Sometimes that might mean that the physician has to rethink whether this is going to be possible or not. A physician would rather know that you are not able to afford this medication and try, maybe not his first choice, but his second or his third choice, and realize that you're going to actually be taking your medication, than to send you off with a prescription that you're never going to have filled. So I would encourage people to just say to their doctor, and just like you're asking, what is this going to do for me? Do you know if this will be covered by my insurance? If your physician doesn't know, someone in the office might know, or he or she may recommend that you call the drugstore and find out. When you get to the drugstore, if you come to pick up your medicine and it's way more expensive than you thought it was going to be, it's okay to say, I'm not going to be able to afford that. The pharmacy's not just going to throw it in the trash can. They're going to offer to call your doctor and help you navigate all that. It's important also to know that there are patient assistance programs available, and you don't have to be destitute necessarily to get help. So always call the question, or always say, this is not going to fit in my monthly budget. There are people at pharmacies and offices and hospitals to help you with those patient assistance applications. And I think the last thing that I would recommend in a situation where you're really worried about the cost of your medicines is say to your doctor, I've never even considered if I might be eligible for Medicaid or some extra assistance that comes along with Medicare. So many patients that we encounter are eligible for all that help, but they didn't know to ask, and we help them, and other organizations help them, and suddenly they can buy medications and groceries. So always raise your hand and ask.
So it goes back to communication is
That's
key.
right,
Open
yes.
communication. Don't be afraid to ask.
That's right.
Always seek additional information whenever possible. Thank you so much. This has been great. A lot of great information today. That's all we've got time for. If anyone wants to learn more information about the Triad Healthcare Network, you can visit them online at triadhealthcarenetwork.com, or you can give them a call at 855-484-6669. If you'd like any additional information on ADTS, you can visit us online at adtsrc.org or give us a call at 349-2343. Thank you for joining us again today, and we hope you can join us next month when Teresa Jackson from the Area Agency on Aging will join us to discuss caregiver issues, caregiver stress, some of the supports and services that are available in the county. So thank you.